In a deeply divided Congress, Republicans pushed through what former President Donald Trump has proudly dubbed the One Big Beautiful Bill, a sweeping legislative package that rewrites key elements of the American tax code, slashes funding for safety net programs, and boosts defense and border security spending. With razor-thin votes in both the House and Senate, the bill is now on the brink of becoming law, awaiting only the president's signature. Supporters call it a historic win for the American taxpayer. Critics say it's one of the most radical and damaging economic packages in decades. What's in the bill? At its core, the legislation locks in and expands Trump-era tax cuts, delivering permanent relief for many Americans, and substantial benefits for the wealthy. Among the major provisions: tax-free tips and overtime. Workers in service industries will no longer pay federal income tax on tips and overtime wages. Higher state and local tax deductions. SALT deduction limits have been raised to $40,000 for most filers, benefiting residents in high-tax states. New deductions for seniors. Americans over 65 making less than $75,000 annually will receive a $6,000 deduction. Child and family credits. An increase in the child tax credit and a new MAGA savings account for newborns were also introduced. Alongside tax changes, the bill boosts federal spending on military and immigration enforcement. $150 billion for national defense. $25 billion for missile defense systems dubbed the Golden Dome. $4 billion for border patrol expansion. Nearly $30 billion for immigration and customs enforcement, ICE. Cuts to social programs spark outrage. While the bill's tax breaks have drawn praise from conservatives, the cost-cutting measures in healthcare and food assistance have provoked widespread condemnation. The legislation includes cuts to Medicaid and SNAP. Tighter work requirements and documentation rules could lead to 9 to 12 million Americans losing access to healthcare and food assistance. Medicare program reductions. Support services for seniors and disabled individuals will see budget rollbacks. Student loan reforms. Income-driven repayment plans are being replaced with less flexible options, raising average borrower payments by up to $2,900 annually. Democrats and advocacy groups warn that the cuts disproportionately harm low-income families, the elderly, and disabled Americans. The economic and political fallout. According to the Nonpartisan Congressional Budget Office, CBO, the bill is projected to add between $2.80 and $3.8 trillion to the national debt over the next decade, largely due to the permanent tax cuts and increased defense spending. This has alarmed credit agencies and some Senate Republicans, including Rand Paul, who called the bill fiscally reckless. Billionaire Elon Musk also voiced strong opposition, criticizing the bill's rollbacks on clean energy and its effect on the federal deficit. Public polling shows the bill is unpopular, with only 29% of Americans supporting it, while 55% oppose. Democrats are already gearing up to use the legislation as a central issue in the 2026 midterm elections. The House narrowly passed the bill in May with a 215 to 214 vote. The Senate followed on July 1, passing it 51 to 50. With Vice President J.D. Vance casting the tie-breaking vote. The final House approval came on July 3, just ahead of the Independence Day holiday. As the bill heads to the president's desk, Republicans are touting it as a cornerstone of a revitalized conservative economic vision, one that emphasizes tax relief, military strength, and immigration control. But the question remains, at what cost? The One Big Beautiful Bill represents a dramatic shift in American fiscal policy. Its champions hail it as bold and visionary. Its critics warn of devastating consequences for the nation's most vulnerable, and for the economic health of the country. As the political battle lines are drawn for 2026, the true impact of the bill may be judged not just in dollars and deficits, but in the daily lives of millions of Americans.